If you're about ready to pick out an explant surgeon and you're trying to research like who are the best surgeons, what do I need to look out for, what should he or she have, what should he or she be doing, and what are some things that should be avoided when it comes to explant surgery, I'm going to cover all of that in this video. Before I get into it, I just want to say this is not medical advice. Everything that I'm going to talk about, and we are going to cover a lot, is just what I've learned after running a group for almost 4 years, how surgery should look, and how an explant surgeon should be practicing when it comes to doing your explant surgery. Because this is a major surgery. This is not a surgery that you want to skimp on and cut corners with. It should be taken very seriously, and especially if you're not feeling well. And if you're new to my channel, hello and welcome. My name's Christina. I'm the founder of Size Happy, and I'm the admin of the best Facebook group on Facebook, Breast Implant Illness, Rejuvenation, and Education with Christina. And you can also find me on Instagram at I am Size Happy. And I want to keep this video very flowy and not so choppy, so I'm going to be referring to my notes over here a lot. But just know, everything that I wrote down, I ran by a couple plastic surgeons just to make sure that I have everything correct. And also I polled the women inside of my Facebook group and asked them, like, what was really important to you when it came to deciding which explant surgeon to choose from? And a lot of that information is on this list as well. So let's get into it. The first thing that I'm gonna kind of dive in with you is, these are the things that you wanna look for like before you go ahead and book that surgery, okay? So you wanna make sure that they are board certified by the American Board of Plastic Surgery, okay? That's very important. You also wanna make sure that they have hospital privileges. So what this means is that if for any reason there is an emergency, they have a privilege at a hospital where they can take you, where there's like no questions asked. And for them to get or have hospital privileges, the hospital is going to see like how many lawsuits they have had, you know, how are their bedside manners, they have good patient reviews, are they up on their training? So the hospital does their due diligence with that explant surgeon to make sure that they're just not accepting anybody into the hospital as far as the plastic surgeon goes, who might just be like a crooked plastic surgeon, for lack of better words. So hospital privileges are really important. You want to make sure that they're a microsurgeon. And some other things that you want to look for is you want to look for reviews. So look for reviews online, and also look for reviews inside of Facebook groups like mine, Breast Implant Illness, Rejuvenation, and Education with Christina. You can do this by simply joining a group, and then in the search bar at the top, put in that plastic surgeon's name, and anybody that's ever made a post about that plastic surgeon or a comment about that plastic surgeon, it'll pop up there for you so that you can kind of weed through and find exactly what you're looking for. So you definitely want to look at reviews, of course, and you want to be careful about any kind of like expert explant surgeon lists inside of any group, including my own. Now, in my group, my members made the list. I had nothing to do with the list. I didn't go and say, oh, this surgeon's good and this surgeon's bad. I didn't make any decisions. It was all my members' recommendations on the surgeons that they went with and if they recommended them. So that is inside of my group. I will link it below, but you'll definitely want to go there. I also made like a master list of explant surgeons who come highly recommended, but who also, and this is where they get the bonus points, they believe in breast implant illness, and they no longer perform breast augmentations using breast implants. That's like a top-notch surgeon to me, because I feel like if you are a surgeon and you believe in breast implant illness, but you're putting in breast implants, you're only contributing to this issue. So it doesn't rub me the right way. And so, you know, everybody has their own standards with what they're looking for in a surgeon. And I think like if you have those really high standards, which we all should, you want to look for a surgeon that not only has all of this and will do your surgery properly and safely, but who also has integrity and believes in us and listens to us and validates us and hears us, right? And who also no longer touches breast implants. I think that's just, we need to be voting with our dollar and holding everybody up to a higher standard of care and what we're really looking for these days. So don't want to jump ahead, but those are some other things, really important things to look for in an explant surgeon. So if you have insurance and you have like a rupture or pain or capsular contracture or anything like that, you definitely want to check out and make sure that your explant surgeon or the surgeon that you're looking into does accept insurance, or at least accepts care credit, which is what I use to help pay for my explant, because a lot of us don't have $8,000, $12,000, $15,000 laying around, right? And so we need a little extra financial support. So if your insurance will cover it, amazing, that's great. If you don't have the money for it, definitely look into care credit and be sure that the surgeon that you are looking into going with will accept that. Now you definitely, I mean, this kind of goes without saying, but you want to make sure they have a good reputation. Like, they have a lot of great reviews, a lot of women are raving about them. And I will say, like, every plastic surgeon is going to have somebody who just didn't have a great experience, doesn't love their results and stuff like that. But if the numbers far outweigh positively of that plastic surgeon's like experience and bedside manners and, you know, their results and everything, and there's just like maybe one or two in there who aren't happy, you know, I would consider that to, you know, be somebody who has good reviews. And you also want to look into their experience. So are they a plastic surgeon who only does explants a couple times a week? Are they an explant surgeon who does like, you know, explants every day, like maybe a couple explants every day? Or are they an explant surgeon who just solely does explants? Like, that's all they do day in and day out. These are just some things to really get clarity on, because of course, like, you know, when it comes to explant surgery, the more skilled they are, the more surgeries they're doing every day, like I feel like the better care they give and the more skilled they are, the more confident they are. They know more what to look out for, you know, if the capsules look weird, if there's like, they have that eye for, you know, the body and especially the breast and getting the breast implants out of you. So you want to just ask and see, you know, how many explants do you do in a day or a week or a month, you know? And of course, in my opinion, you want to pick somebody who's doing them every day, or at least every day, or who only does explants like from now on. Like, they're just so overwhelmed with the women coming to their office that like all they do every day is just explants. So those are some things to really look out for when you're considering an explant surgeon. Now, when like you go to the consultation and you're able to dive deeper and ask some questions, first off, I do have a guide. It's called Discovering Breast Implant Illness, What Now? I will link it down below for you, but it has all the consultation questions in it. So, you know, there's a lot of questions in here. You can kind of pick which ones are really important to you, but some non-negotiables when it comes to picking an explant surgeon and doing your explant properly and safely is you want to make sure that your explant surgeon, whoever you choose, is going to do your explant en bloc. And so what that means is they're going to take the capsule and the implant out together in one piece. They're not going to cut the capsule open and then, you know, take out the implant and then go back in and take the capsule out. Although sometimes, just for safety reasons, they might need to do that. But you want to just make sure that they're very confident that, like, yes, I can take your implants out en bloc. I can take it out with the capsule. That's how I do it. That's how I prefer to do it. That's just the best way to do it. And so you want to hear that back from your surgeon. If a surgeon says like, no, we're not going to take the capsule out, or, you know, we'll see how you look when we get in there, I would personally say find a different surgeon. This is just something that you don't want to compromise with. It's like a non-negotiable. The capsule needs to come out, preferably with the implant. And the reason for that is because if your implant is leaking or ruptured, sometimes the surgeons don't know until they get in there. And I can't even tell you how many times I've seen an implant come out on block, but then when they open the capsule and they look at the implant, it's just mush. And imagine if your explant surgeon, you know, cut the capsule inside of you, not knowing that there was a ruptured implant inside of you. You run the risk of those chemicals and those toxins going into your bloodstream and just further adding to these problems. So it's just really important, I'm just going to emphasize that again and again, that the explant surgeon that you choose, you want to make sure that they are confident in doing it en bloc. And they're like, yes, that's how we do it. That's how I like to do it. That's the best way to do it. You want to also make sure that they're going to do a total capsulectomy. So what that means is, you know, once they take the implant and the capsule out, if there's any remaining capsule or silicone or anything that's attached to your ribs or your muscles or up in your armpit or anything like that, they're going to totally clean all that stuff out. So they're either going to peel it off or scrape it off or cauterize it, but they're going to leave you with a completely clean chest cavity. Okay, so those are two things that you want to make sure that your explant surgeon is going to do. You also want to run by and see if they'll do the CD30 pathology test, and that's the test that tests for BII-ALCL, which is that cancer of the immune system that has been linked to breast implants. Some surgeons will only do that upon request, which is totally fine. Some surgeons just do it regardless, right? It's just like part of their process. They always get all the capsules tested, especially if you've been feeling really sick or you have any kind of symptoms of BII-ALCL. Now you'll want to see if they'll give you your implants back also. That's just, for some of us, it's very important. We want to have our implants back. It was a part of us. Some surgeons won't give it back for whatever reason, but it's definitely something that you want to see if your explant surgeon will do. Most of them do. Some of them don't for whatever reason, not sure. And of course, if they're ruptured and they're just ooey gooey, then you're not going to want those back anyway. You know, while you're there at the consultation, request to see some before and after photos. Some explant surgeons also have social media channels, so you're able to see kind of like before and after photos of their patients on their social media channels as well. Some explant surgeons have their own Facebook groups, so you can go to like Dr. Deb, which was my plastic surgeon, Dr. Deb's, you know, explant patients, and all the patients who are either considering using him or who have already used him are inside of that group, so that you kind of are amongst a community of women who also had your same explant surgeon, and you can kind of run things by them like, hey, what should I expect with my surgery? Or like, what should I be expecting after my surgery? And you just kind of have like that community and that comfort and that clarity and that confidence, you know, being a part of something that is familiar to you. I kind of mentioned this earlier, but I feel like it's really important that your explant surgeon, whoever you choose, you just feel really comfortable with. They are kind, they are compassionate, they are patient with you, you feel that they care, they want to help you. You just, you know that feeling, right? So for me, the energy that I felt from my plastic surgeon was very important. And then, you know, a couple optional things, but you'll definitely want to see if your explant surgeon will do this is, will they do any muscle repair if you need it? Do they use drains? Some do and some don't. And again, every plastic surgeon kind of has their reasons for both, but just to get some clarity, like, do you use drains or not? And then also, do they offer something called nerve block, which will help with any kind of pain for about 3 days after your explant surgery. And then you also want to make sure, or not make sure, but just kind of see if they'll take photos for you of your implants out on block, so with the capsule on it, and then, you know, another picture with your implants and then the capsule you know, sitting next to it, or a video, just to have clarity and knowing that your explant surgeon did things right. They did the en bloc, right? They did what they said they were going to do, because I can't even tell you how many stories I've heard from women who the surgeon was like, yeah, I'll try to do it en bloc, I'll try this, and they're the surgeons that don't typically believe in breast implant illness, so they don't fully understand the importance of doing the explant surgery properly, which is en bloc with a total capsulectomy. But they're like, yeah, we'll do it. And then come to find out, they don't have any pictures to prove that it was done en bloc or that their capsules are even out. And the reason why they start thinking that is like they're 6 months to a year down the road after their explant and they're still feeling sick. And they're like, I feel like I should be better by now. I never got any pictures back of my actual implants or the capsule. And so again, you just got to be very careful and do your research and do your due diligence before like hiring an explant surgeon. So see if they'll do some photos and videos for you to have peace of mind, and then see what kind of other things they offer. So the muscle repair, the drains, and the nerve block. There are bonus points. So these are like, if you have really high standards. So like I kind of mentioned, they believe in breast implant illness and they no longer do breast implants. Those are really important to some women, especially the women who are very, very sick. To other women, and you know, I would say it's like 90% of the women that I see are very sick and they like know they have breast implant illness. And then I would say like 10%, they're not like too sick, but they don't want to get sick. So that's why they explant. But I feel like, you know, if you are very, very sick, I think having somebody who believes in breast implant illness working on you and who no longer does breast augmentations using breast implants is just like, it's so super important to us these days. And I can't stress it enough that we really got to start holding these surgeons up to higher standards and voting with our dollar. With all of that being said, I know that there are certain circumstances where like, look, you don't have the luxury of being able to travel to one of those surgeons, right? You don't have the money. And so you really just have to go to a surgeon who's within your budget, within your location, right? And so at the end of the day, just do what you can and what's best for you. You know, that's all we can really do. So I know that some of these things are like, yeah, but like if I were to go to this type of surgeon, I would have to travel to like Michigan, or I would have to travel to Miami, right? And like, I just can't afford to do that. And so, you know, I totally get it. Just do what you can, but also like really don't sacrifice or compromise when it comes to some of these things. You want to make sure that your explant surgery is just done the right way the first time, because there are quite a few women who remain sick and then they come to find out that their capsules were still left inside of them, and they go in for another surgery like a year and a half later, and the surgeon takes out some capsule that was left in them, right? And so you don't want to have another surgery possibly later down the line. You want to get everything just done right the first time. So a couple things that you want to make sure your explant surgeon, whoever you're choosing, will not do. Like, first off, like if they say, I'm not going to do it en bloc and I'm not going to remove the capsule, like your body will dissolve the capsule, there's no need, don't do it. Find a different surgeon. If they say that they're going to go through your areola, again, no, because when you do the explant properly and you do it en bloc, you need to make a large incision to be able to take the implant and the capsule out together in one piece, right? And so you can't get all of that out by going through like a 1 to 2 inch incision. My incisions go all the way to like right here, and they're all the way under to like here. I have pretty big incisions. You can see them in my cleavage area, like with your bare eye. So, you know, you want to make sure that they're not going to go through the areola. And then the last thing, we're going to wrap it up here, is especially if you have saline breast implants, they're not going to drain your saline breast implant while it's still inside of you. And the reason why is because saline breast implants are notorious for having things like mold, bacteria, and fungus floating around inside of them because of a faulty valve. So I always say, you know, if you go under the breast implant illness hashtag or the explant or explant surgery hashtags, you will see pictures and pictures of, you know, explant surgery, you know, the implants with the capsules laying on the table because they did the surgery en bloc. Like, you're going to see everything, and you're going to see pictures of ruptured breast implants, and you're gonna see pictures of breast implants, like saline breast implants that have mold and bacteria and fungus like floating around inside of them. So it's a big no-no if you have saline breast implants. If your surgeon says, yeah, we're going to drain that inside of you first, and then we'll, like, no, don't do it. Those are just 3 things that are just big red flags. Don't risk it. This is your health. This is your life. This is your livelihood. This is your one chance to get back to feeling like you again. So there's just some things that you don't want to compromise on. If you have any questions about any of this, if you need me to elaborate a little bit more about maybe like hospital privileges, or, you know, where can I go for reviews? Like, what's your Facebook group? Where can I find the list of explant surgeons who, you know, believe in breast implant illness and no longer do breast augmentations using breast implants? There's only a very short list that I've created. There's like 8 to 10 surgeons on there that I know of, at least in the United States, who are just top notch. Just run anything by me. I'm happy to explain anything to you, clarify anything. And again, make sure that you download and print this guide out. I'm going to link everything down below, my Facebook group, this guide, so that you have the explant surgery consultation questions. And then also in this guide, you'll find some post-op care, like, you know, things to expect from post-op care. And then while you're here on YouTube, I do have a video like what to expect from explant surgery. So you're gonna kind of get the rundown of like how long it takes, what it like looks like, you know, what to expect kind of after, and all of that. So make sure that you check out that video too, and be sure that you like this video if content like this is, you know, things that you're looking for, and be sure that you are subscribed also. So thanks so much for sticking with me through this entire video. If you have any questions, like I said, let me know. You can either email me at Christina@SizeHappy, or you can find me on Facebook and DM me there. All right. Oh, and also new Size Happy merch. I will link this down below too. All right.